Alright, so let's talk about money. Big money. China recently made a huge announcement. They're pledging a whopping $500 million to the World Health Organization, or the WHO. This isn't just a friendly donation, it's a statement. It's like showing up to a potluck dinner, and while everyone else brought a small salad or a bag of chips, China just rolled in with a 5-star, 10-course meal. You can't help but notice, right? This pledge is spread over 5 years, so it's a sustained commitment. The WHO, which is supposed to be the world's doctor, has been going through some stuff. Financial stuff, political stuff, you name it. So, when a major global power like China steps up with this kind of cash, it makes waves. It signals a potential shift in who's calling the shots, or at least who's helping to pay the bills in a very big way. It's more than just generosity. It's about presence, influence, and shaping the future of how we all tackle health crises together. Global health is like a massive, complicated group project. Diseases don't care about borders. A problem in one country can quickly become a problem for the entire world. So, when a country like China decides to invest heavily in the WHO, it's not just about the WHO's budget. It's about bolstering the world's ability to respond to pandemics, fight diseases, and ensure even the poorest countries get a fair shot at good health. Now, to really get why China's big pledge is such a headline grabber, we need a little backstory. Remember the United States? For a long time, America was like the WHO's main financial backer, the biggest donor, the one who always picked up the tab. They poured hundreds of millions of dollars into the organization every year. This wasn't just about money, it was also about leadership, setting agendas, and projecting American influence in a really important global institution. The US played a massive role in shaping global health policies for decades. Then, in 2020, things took a sharp turn. President Trump announced that the US was pulling out of the WHO, just like that. "We're done," he basically said. The reasons given were pretty serious. He accused the WHO of being too China-centric, mishandling the initial response to the COVID-19 pandemic, and needing major reforms. It was a dramatic breakup, played out on the world stage. Imagine the biggest investor in your company suddenly saying, "I'm taking my money and leaving." That's bound to cause some chaos and uncertainty for everyone involved. So what happens when the top funder walks out the door? Well, for starters, it leaves a giant hole in the budget. The WHO relies on contributions from member states to do its work, everything from fighting polio to responding to Ebola outbreaks. Losing a significant chunk of its funding overnight is a massive blow. Beyond the money, it also created a leadership vacuum. The US had always been a powerful voice at the WHO. Suddenly that voice was gone, or at least significantly quieter for a while. This created an opportunity, a space, if you will. So, fast forward a bit, and China steps onto the stage with this $500 million pledge. This wasn't just a quiet memo sent to the WHO accounting department. Oh no, this was announced with some fanfare. Chinese officials, including Vice Premier Liu Guozhong, made it clear that this was a significant commitment. At a high-level event, Liu emphasized China's dedication to global health security and its support for the WHO's central role in coordinating international efforts. The money itself, $500 million, is earmarked to be delivered over 5 years. That means an average of $100 million per year. To put that in perspective, it significantly boosts China's previous contributions and places them among the WHO's top financial supporters. The official statements accompanying the pledge focused on themes like solidarity, multilateralism, and building a global community of health for all. China is framing this as a responsible action from a major global power, stepping up to meet shared challenges. They are essentially saying, "We're here to help, and we're putting our money where our mouth is." The World Health Organization, despite its grand name and critical mission, often finds itself scrambling for cash. The WHO's budget is primarily funded by two sources: assessed contributions, which are like membership fees paid by countries based on their wealth and population, and voluntary contributions. These voluntary contributions, which make up the bulk of the funding, come from member states, other UN organizations, international bodies, and even private donors. So when a major donor changes its tune, it really impacts the WHO's ability to function effectively. The temporary US withdrawal, and even before that, fluctuations in funding always put pressure on the WHO. China's $500 million pledge over 5 years is a significant boost to the voluntary contribution side of the ledger. It helps to provide more predictable and stable funding, which is crucial for long-term health programs. Think about it. You can't effectively plan a campaign to eradicate a disease if you're not sure you'll have the money next year. This kind of multi-year commitment is exactly what organizations like the WHO need to make a lasting difference in global health outcomes. So China's increased funding is part of a larger ecosystem of global health financing. Section 5. Expert takes China's strategy and influence. So what do the people who study this stuff for a living think? The experts, the academics, the policy wonks?
Well, there's a range of opinions, as you might expect. Many see China's increased funding to the WHO as a clear example of soft power in action. Soft power is all about attracting and persuading rather than coercing. By investing in global public goods like health, China can improve its international image, build goodwill, and subtly expand its influence. It's a way of saying, look, we're a responsible global leader, and we're contributing to the common good.
Some analysts believe this is part of a broader, long-term strategy by China to reshape global governance. For decades, international institutions like the WHO, the UN, and the World Bank were largely shaped by Western powers, particularly the United States.
Now, China, with its growing economic and political might, is seeking a more prominent role. Investing in these institutions, and even proposing new ones, is a way to ensure that global rules and norms better reflect its interests and its vision of the world order.
Section 6. The COVID question. Whose impartiality under scrutiny? Now we can't talk about the Ho in China without addressing the giant spiky elephant in the room, the COVID-19 pandemic. The early days of the pandemic saw the Ho come under intense fire. Critics, including the former US administration, accused the organization of being too deferential to China, where the virus first emerged. There were concerns about the speed and transparency of information sharing from Beijing, and questions about whether the Doju pushed hard enough for answers or access for international investigators. This period definitely damaged the WHO's reputation in some quarters. These criticisms centered on whether the WHO was truly impartial. Section 7. The Taiwan Puzzle. Geopolitics at the health table. Another really sensitive issue that often comes up in discussions about the HO and China is Taiwan. Taiwan, which has its own democratically elected government and a highly regarded public health system, is not a member of the WHO. Why? Because China considers Taiwan to be a breakaway province and objects to its participation in international organizations that require statehood. This is all part of Beijing's One China policy, which most countries in the world and the UN system acknowledge. It's a complex geopolitical knot. Section 8. Beyond the pledge, China's broader global role. China's $500 million pledge to the WHO isn't happening in a vacuum. It's part of a much larger pattern of China taking on a more assertive and influential role on the global stage. For years, China has been steadily increasing its engagement with international institutions, not just in health, but across a wide range of areas, from trade and finance to development and peacekeeping. This is a natural consequence of its rise as a major economic and political power. It's moving from being a participant in the global system to actively seeking to shape it. Think about the Belt and Road Initiative, China's massive global infrastructure development strategy. This ambitious project involves investing billions of dollars in railways, ports, highways, and energy projects across dozens of countries in Asia, Africa, Europe, and beyond. While often framed in economic terms, the BRI also significantly expands China's geopolitical footprint and influence. Similarly, China has been a key player in establishing new multilateral institutions like the Asian Infrastructure Investment Bank. Section 9. Conclusion. A new chapter for global health. So let's wrap this up. China's $500 million commitment to the World Health Organization is undeniably a big deal. It's a significant financial injection for an organization that's always in need of resources to tackle some of the world's toughest health challenges. On the surface, more money for global health is good news for everyone. It means more programs can be funded, more lives can potentially be saved, and the world can be better prepared for the next inevitable health crisis. This is the straightforward, positive take on the situation. However, as we've seen, this pledge also comes with a whole host of complexities and potential implications. It alters the financial landscape of the WHO, making China one of its most important donors. With money often comes influence, and this shift could subtly or not so subtly change the political dynamics within the organization. Who sets the priorities? Whose concerns get the most attention? These are the questions that will be debated and observed closely in the coming years.